Cancers has been listed to the second leading factors of death in the world, according to the World Health Organization in 2018. I guess many people are afraid of cancers as it is commonly known as a disease which is very hard to cure. When thinking of the treatment of cancers, what comes to your mind? Yes, chemotherapy, which is the therapy that applies cytostatin, toxins that kill cells into the patient's body. However, do you know that there are different treatments available? Today, I am going to introduce you one newest treatment of cancers that could potentially cure the cancers efficiently. It is the chimeric antigen receptor cells therapy, CAR-T cells therapy. It is a therapy which makes use of your own body T cells, immune cells, to fight against the cancers. CAR-T cells therapy requires 4 basic steps, which is collecting T cells from the patient's body, modify T cells by using genetic engineering, expanding the numbers of the modified T cells, and finally, reintroduce the modified T cells into the patient's body. Before I proceed to the concept of CAR-T cells therapy, let me tell you how immune cells works. Immune cells are like a group of police to maintain the body's safety environment by killing the bad guys. The bad guys are any substance that can cause harm to our body, such as virus, bacteria, and cancer cells. There is a detection system on the surface of immune cells called receptor. On the other hand, there is a form of label on the surface of bad substances, which is called the antigen. To let the police catch the bad guys, both shape of the antigen and the receptor should be matched. Thus, the receptor of the immune cells could then only bind to the antigen of the bad substances to eliminate them. Now, let us change our focus back to the CAR-T cells. The CAR-T cells are the modified T cells during the genetic engineering steps to form the receptors that is specifically complement to the antigen of cancer cells. In this case, the patients that receive CAR-T cells treatments would gain a large amount of police that is trained specifically to target the cancer cells. So, the cancer cells would be eliminated efficiently by the patient's own body immune T cells. Now, there have been successful cases of using CAR-T cells therapy to save patients that are unable to be cured using chemotherapy. In the current state, CAR-T cells therapy is only efficient to the hematologic cancers such as leukemia and B-cell malignancies. However, scientists are trying their best on researching methods to apply CAR-T cells therapy on the solid tumors as well. I believe that CAR-T cells therapy would be the future and hope for treating cancers. I hope by now, you will gain a new sight of treating cancers. Thank you very much, and let us hope for the best.